One of the worst flu outbreaks in recent years is sweeping across the United States, and despite being half a world away, people in Korea are concerned it could spread here. Our Heo Seung-ha tells us how worried we should be.
The deadly flu epidemic in the U.S. has killed at least 100 people, and the number of patients who have come down with influenza here in Korea is also on the rise. Last week, 3.7 out of every 1,000 people in Korea were diagnosed with the flu, and the Korea Centers for Disease Control and Prevention says the figure is expected to surpass 4 out of every 1,000 people this week, which would lead to the center issuing a flu alert warning. However, the types of viruses affecting the United States and those affecting Korea are different. Although both of them are associated with the influenza A virus, the one in the U.S. belongs to the H3 subtype and the one in Korea the H1 subtype. An official from the nation's health agency says the H3 subtype carries with it more severe symptoms like body aches and complications that can lead to pneumonia. And even if the H3 type virus spreads to Korea, people won't have to worry all that much. That's because Korea has a relatively high vaccination rate. Some 16 million people have already been vaccinated, and the vaccine prevents both the H3 and H1 viruses. But still, since the flu warning is expected to be issued in the coming days, experts advise that people wash their hands frequently. It's also recommended that children, the elderly, people with chronic diseases, and pregnant women be vaccinated if they haven't been already. Unlike in the U.S., where there is a shortage of flu vaccines, there is sufficient supply in Korea, enough to vaccinate 7 million patients. Heo Seung-ha, Arirang News.